The nutritional assessment is an important part of providing optimal patient care. Defined by the World Small Animal Veterinary Association, or WSAVA, and the American Animal Hospital Association, the nutritional assessment is the fifth vital assessment, following temperature, pulse, respiration, and pain, which should be performed on every patient at every visit. Its purpose is to quickly define a patient's nutritional status, identify those at risk of malnutrition, and to monitor changes in a patient's nutritional status. The nutritional assessment occurs as a two-part process, which starts with the nutritional screening. To do the screening, key information should be collected, including details specific to the animal, their diet, and the feeding management and/or environment. For instance, nutritional screening risk factors observed during history taking could include things such as unexplained weight changes, a history of vomiting or diarrhea, or previous or ongoing medical conditions. During the physical examination, nutritional risk factors include patients with a body condition score less than 4 or greater than 5 out of 9. Also, those with muscle wasting, dental disease, or poor skin or hair coat. This screening process only takes a few minutes and provides information about a patient's nutritional status. If no risk factors are found during the screening, then the nutritional assessment is complete for that visit. However, if one or more nutritional factors are found, then an extended nutritional evaluation may be indicated. For this, additional history and a further diagnostic workup may be needed. More information about the nutritional screening and the extended evaluation can be found in the 2011 WSAVA Nutritional Assessment Guidelines. A nutritional assessment should be part of routine history taking and physical examination, and quickly become second nature after doing it a few times. However, we do know that veterinary clinics are extremely busy, so time is limited, and so making changes to habits can be difficult. To help with this, resources have been developed to help veterinary professionals integrate a nutritional assessment into their daily routine. These resources can be found in the WSAVA Nutritional Toolkit, which is available online. This toolkit is offered in 12 languages and contains things such as a nutritional assessment checklist, a 3-step process for integrating a nutritional assessment into daily practice, dietary history forms, and hospital feeding guidelines. It also contains printable information documents that you can provide for owners as well. As nutrition can play a key role in the management of dermatology patients, it's important to have a good understanding of a patient's dietary background. Performing a nutritional assessment may uncover a history of a patient being fed unconventional diets, for instance. This is relevant because deficiencies in several essential nutrients can lead to poor skin and coat condition. In addition, for a food and elimination challenge trial, a thorough dietary history is needed to determine the most appropriate choice of diet. When taking a thorough dietary history to determine the most appropriate diet for a food and elimination challenge trial, some things that are overlooked include treats that are given for dental hygiene, such as dental chews, flavored flea, tick, and other parasitic medication, flavored toothpaste, and human foods used to hide medications in. Therefore, when taking a patient's history, it's important to ask about these things to owners separately. Also, make sure to ask to the owners how they are giving the medication if the dog or cat is receiving any. Finally, knowing whether there's a tendency for scavenging of food or feces or hunting behavior is also important to know, as these will have to be addressed and tried to be avoided during the food trial. When taking a patient's history, one of the most challenging aspects is getting a full picture of what a dog or cat is being fed. This can be particularly difficult when owners are mixed feeding with a variety of diets or brands, or if they treat a lot with human foods. In these cases, it can be helpful to either send owners home with a dietary history form and ask if they could write down any food given to the dog or cat over a period of a couple weeks, or alternatively, emailing the dietary history form prior to the consultation and ask owners to fill it out at home. This will allow owners to answer the questions more accurately because they'll be able to consider their answers carefully on their own time, and they can reference the diets in their home as well. Another recommendation is to ask owners to take photos of the different diets they feed, including the name and ingredients list, and provide that as well as the dietary history form.